Rare diseases, challenges and advances in diagnosis and treatment. Welcome to our channel, where we discuss rare diseases, their diagnosis, and cutting-edge treatments. Rare diseases, also known as orphan diseases, affect a relatively small proportion of the population, often defined as fewer than 1 in 2,000 individuals in Europe or fewer than 200,000 people in the United States. While each rare disease may affect only a small number of people, collectively, these conditions impact millions worldwide. The challenges and advances in the diagnosis and treatment of rare diseases are multifaceted and deserve a comprehensive examination. Before we begin, make sure to smash that like button and hit the subscribe for more exciting content. Challenges in rare disease diagnosis. 1. Limited awareness and knowledge. One of the primary challenges in the field of rare diseases is the lack of awareness and understanding. Many healthcare professionals are not familiar with these conditions, leading to delayed or misdiagnosis. 2. Heterogeneity. Rare diseases are highly diverse, encompassing over 7,000 distinct conditions. Their symptoms can vary greatly, making diagnosis challenging. The lack of a standardized approach further complicates the process. 3. Diagnostic delay. Due to the rarity and complexity of these diseases, individuals often face a prolonged diagnostic odyssey, with some waiting years or even decades for a proper diagnosis. This can lead to significant physical and emotional suffering. 4. Inadequate screening and testing. There is a shortage of specific diagnostic tests for many rare diseases. Some require costly and time-consuming genetic or molecular testing, which may not be readily available. 5. Limited research and data. Rare diseases typically receive less research funding and attention compared to common diseases. This dearth of research can slow down the development of diagnostic tools and treatment options. 6. Access to expertise. Rare diseases often require specialized knowledge and expertise for accurate diagnosis. Patients may need to travel long distances to reach centers with the necessary specialists. 7. Financial burden. The costs associated with seeking a diagnosis, including multiple medical consultations, genetic testing, and treatments, can be a significant financial burden for patients and their families. Challenges in rare disease treatment. 1. Lack of approved therapies. Many rare diseases have no approved treatments, leaving patients with limited options. This is particularly true for ultra-rare diseases, with only a handful of known cases. 2. Orphan drug development. Developing treatments for rare diseases can be economically unattractive for pharmaceutical companies due to the small patient populations. Incentives such as orphan drug status are in place, but the process can still be slow and expensive. 3. Off-label use. Some patients resort to using medications off-label, using a drug for a different condition, in the absence of approved treatments, which can be risky. 4. Access to treatment. Even when treatments are available, access can be limited due to factors like high costs, lack of insurance coverage, or geographical constraints. 5. Side effects and long-term effects. Rare disease treatments can be experimental or have limited safety data, raising concerns about side effects and long-term consequences. Advances in rare disease diagnosis. 1. Genetic sequencing. Advances in genomic technologies, including whole exome and whole genome sequencing, have greatly improved the ability to identify genetic mutations underlying rare diseases. This has led to more precise diagnoses. 2. International collaborations. Initiatives like the International Rare Diseases Research Consortium, IRDRC, promote collaboration among researchers, clinicians, and patients to accelerate rare disease diagnosis and treatment. 3. Telemedicine. Telemedicine and teleconsultation break down geographical barriers, allowing patients to remotely access expert medical advice and diagnosis. This technology is particularly beneficial for individuals with rare diseases, ensuring they can connect with specialized healthcare professionals regardless of their location. 4. Big data and AI. Big data analytics and artificial intelligence offer valuable tools for rare disease diagnosis by uncovering patterns and associations within complex data sets. These technologies empower healthcare professionals to make more accurate and timely assessments, improving the chances of early intervention and effective treatment for those affected by rare diseases. 5. Patient advocacy and online communities. Rare disease patient organizations and online communities have played a significant role in raising awareness and providing support for those affected by rare diseases. Advances in rare disease treatment. 1. Orphan drug legislation. Many countries have introduced legislation to incentivize the development of orphan drugs, providing financial and regulatory benefits to pharmaceutical companies. 2. Gene therapy. Advances in gene therapy have opened new possibilities for treating some rare genetic diseases by directly addressing the genetic mutations responsible. 3. Precision medicine. Tailoring treatment to the specific genetic or molecular profile of the patient is an emerging approach, increasing the likelihood of successful treatment outcomes. 4. Repurposing existing drugs. Researchers are exploring the potential of existing drugs for treating rare diseases, bypassing the lengthy drug development process. 5. Patient-driven research. Patient registries and collaborations with patient advocacy groups empower individuals to participate in research, facilitating the development of treatments and clinical trials. 6. Rare disease designations. Designations like Rare Pediatric Disease Priority Review Voucher in the U.S. and Orphan Drug Designation help accelerate the development and approval of treatments for rare diseases. In conclusion, rare diseases present a complex landscape of challenges in diagnosis and treatment. While significant progress has been made in recent years, there is still much work to be done to ensure that individuals with rare diseases receive timely and effective care. Increased awareness, continued research, and collaboration among healthcare professionals, researchers, pharmaceutical companies, and patient advocacy groups are essential to improving the lives of those affected by rare diseases. Additionally, ongoing policy and regulatory support is crucial to incentivize the development of treatments for these often neglected conditions. If you find our videos helpful, don't forget to share, subscribe, and hit the like button to support our channel.